trauma work and like release work and all of that, but then we're wearing the same suit. Because if we blast past the superficial fascia, we're blasting past the autonomic nervous system. And that will continue to create the bracing patterns. And the body's like, you did not pass the test. You did not work with this layer. You forced past. And she's not punishing us, but it is this opportunity of great teaching and wisdom to work with these layers so that we are preparing for the deeper work, emotionally, physiologically, spiritually, and ultimately upgrading the suit that we are wearing so that when we do all this deep transformation work, it actually holds and we actually feel like, like I feel open-hearted. Then all this heart work and heart opening, now you can actually feel it. Then we get down, of course, we have layers of pec major, pec minor. Ribs are here. There's muscles in between each rib, and there's also fascia between all of these layers. Then we get down into the lungs, also fascia around the lungs and around the heart. And when our breath and our rib cage is stuck, all of this can become stuck as well. And this is our diaphragm that sits just below our heart, touches the pericardial sac. And the diaphragm is designed when we take a breath to move down when we breathe in and up as we breathe out. So what this is doing is not just creating more space for our lungs to expand, right? It is also massaging the organs where it should be massaging the organs below it, including the liver, which has over 500 functions in the body. So when that is stuck and the liver isn't moving, or the liver isn't getting that massage, the stomach isn't getting that massage, the pancreas and spleen aren't getting that massage, that impacts health body-wide. And this is, of course, mirrored in the pelvic diaphragm or pelvic floor, which should be moving in tandem with the thoracic diaphragm with every breath that we take. And when we do this work up above, I would say never, unless somebody's like a practitioner or a blood relative, do a pelvic care session before doing, if I haven't done a breath of life session with somebody, because it's kind of a waste of time. Because if this is all stuck above, then that is going to be mirrored below, no matter how great of work we can do and how much release happens. If that stuckness isn't mirrored, or if that freedom isn't mirrored above, then there is going to be limitation to how much that can integrate into the body. And again, I'm not saying other ways are wrong. I'm saying that my approach is about asking the question, how do we inspire organic unfurling through the body so that we aren't just doing a session and getting a little release and then it goes back? It's like, how do we actually work? And this requires working with the fascial structure and the autonomic nervous system really as one, because the order matters, the approach, the energy, the setting all matter. And that is part of the reason that we have the nest space. This image does show CNX, or cranial nerve 10, or the vagus nerve, which of course is not just a single nerve that runs down through from your brain to your cervix. It actually runs on both sides of your body and through your neck and down into the heart area. Like you can see it right, where is it? This is the vagus nerve on this side. So when there is restriction in our tissues, in our fascia, in our breath, that is impacting our nervous system at a physical level. And you can do all the regulating work in the world, but you will still have nervous system patterns that are coming up, like digestive issues, hormonal imbalances, fertility challenges, anxiety, etc., because the physical nerves actually need nourishment. They actually need fluidity and blood flow and lymph flow moving near and through them, because the nervous system is a fascial structure. It is all wrapped in fascia. And our heart is wrapped in this beautiful pericardial sac that is also fascia. And if you think about when something is stuck over time and there's just less space for it, the fascial layers get stuck. So it doesn't require scar tissue to create adhesion, it just requires lack of mobility. And over time, that stuckness can expand. One way that I've observed the heart being quite impacted through really tight breasts and chest is that I'll feel the pulse really, really hard in the belly, in someone's belly. And, you can always feel some pulse in the belly because there are major blood vessels that run through that center. But when it's like this pounding, what is happening is the heart is having to beat really, really hard because it has to work harder to pump blood in with tissues that are restricted. Versus when the fascia is mobile and fluid as designed, there's more ease in that motion, right? And this thinking about how that works with the fascia when it's stuck versus when it's moving and free and fluid, it requires more energy to do basic functions when our fascia is stuck. When our rib cage is squeezed tight by fascial patterns that we've held in our body for decades, that is going to take more work to take a breath. Right? And you can even squeeze on your side body right now next to your breath, next to your breasts, and breathe. And notice, of course, that takes more work to push against that pressure, right? Versus when you take your arms off and you feel that contrast. It's a lot easier. And the coefficient of friction demonstrates how it takes more energy when there is more friction to move something, which is like, okay, duh. But it's really important to think about our body this way, that if there is fatigue present, if the body is having to work so hard just to take a breath, just to pump blood, that, changing diet, taking a supplement, so many other, even doing like a massage isn't going to shift those patterns. It's not going to make it easier for the body to actually function, which is ultimately draining life force. It takes more energy to move with this constriction, to be with this constriction. Then when we free this pattern, as we will do next week, every breath you take requires less energy for you to take that breath. Every breath you take is going to bring in more oxygen, because when you fill your lungs more, not by just taking a deeper breath, but because there is more space for that breath to occur, even when you sleep, more oxygen happens in every cell. And oxygen is a disease fighter. This is why they use oxygen therapies for things from cancer to autoimmune issues. Like, everything can be addressed with more oxygen, and you don't need a hyperbaric oxygen chamber in order to make that change. You just need to be able to take a deeper breath. When you lose a family member and you feel your heartstrings pulled apart, could that be fascia? I think so. Yeah, because the fascia, it is a construct of light and sound and movement. And it is, it's our light body in form. So our light body aura is out here. And as we come into the physical body, into the physical form, it morphs into fascia. And so all of that information is being zipped through. And of course, when, you lose a family member or someone close or a pet, that has a physical effect on our tissues. You know, that emotion of like deep grief is not just a energetic or electrical current. It's also like, how is that impacting our physical tissues? Yeah, great question. Okay, moving into the chest. This is looking from behind. So your breasts are on the other side of my cursor right here. The breasts sit there. So you can see that there's these really cool little muscles all wrapped in beautiful fascia that sit on the inside of your sternum and tie into the diaphragm, which is right here. And then here's the inside of your abdominal muscles. Look at that literally braiding through the body. If you've ever doubted the intelligence and the intricacy of this wisdom, it is incredible. And this, of course, on this side is the heart. So the heart is just removed on this picture, but the heart sits right here. So it's literally woven into this nice little basket. Check out all these nerves. All of these nerves running through the heart space that are being informed. You know, the schools of thought that use the chakra system, that is also represented in bundles of nerves and nerve plexuses through the body, including in our heart space. So when we're freeing this space physically and energetically, that combination, while also taking a moment to just have some awe and wonder in our body, that is shifting our entire nervous system. It's big work.